CEO Performance and Search Committee meeting. Glad everyone can make it. As always, we have the hospital's provided us lunch during the meeting, and we really appreciate that. Invite everybody who's in attendance at any point in the meeting or afterwards to please join us for lunch. Thank you to Ms. Lester for giving me these fashionable reading glasses because I left mine in my car. So I may go with purple the next time I'm at the pharmacy. The first item on our agenda is to ask if there are any conflict of interest of any of the committee members. Does anyone have a conflict of interest that they need to state? If not, we will go to the public comment portion of our meeting. Ms. Lester, do we have any public comments?
No, sir.
Thank you. There being no public comments, we will move to the approval of the minutes from our previous meeting, which was on March 18th, 2026. You received those in advance of the meeting. Is there a motion to approve our previous minutes?
So moved.
Second.
There's a motion and properly seconded. Any discussion? All those in favor of approval of the previous meeting minutes say aye. Aye. Any opposed? We've approved the minutes of our previous meeting. Oh, thank you very much, Dr. Nettles. I have overlooked the item on our agenda, which is an important one, to read our mission statement. Dr. Miller, would you please read the hospital's mission statement?
To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you, Dr. Miller. Moving to the new business, I will turn it over to our friends from AMN Healthcare, who are going to take us through the proposed slate of candidates in our discussion today.
Great, thank you so much. Looking forward to being here. We'll go through, I want to recap for the search committee members, board members, the work that's been done today, the focus of our work, what we were looking for as we went to market and identifying candidates. So we'll give a recap of what that looks like, a reminder of maybe some of the things that we were working towards. Am I good? It is, yeah. Yeah. And just a reminder to the board members of the focus that we took and the lens in which we evaluated candidates. And so we'll start with that. And maybe as a reminder, as we review the candidates today for the same reason, is a focus on the purpose of what we agreed upon to begin the search. So we'll do that. And then we will get into discussion of each of the candidates. We have 9 candidates to present today. We're going to do that as eloquently as we can with the restrictions that we have to respect the confidentiality of the candidates in which we're talking about. So we'll try to answer as many questions as we can. Certainly want it to be a discussion as well, and we will certainly be prepared to answer most, if not all, questions that you have related to it. Any questions, directions, thoughts before we get started from the group? All right. Julie, do you want to kind of give a recap of maybe the focus of the prospectus and what we were looking for when we went to market?
Absolutely. Hello. Good seeing you guys all again. Yes, so as we are walking through the candidates, I just wanted to briefly reset the mandate of the search, and after extensive stakeholder interviews, the lens that, based upon those conversations, we've asked our team and now you to use as you're evaluating each of the individuals. So based on those stakeholder interviews and where Nashville General is today, this is not a maintenance role. It's very clear this is definitely a repositioning transformation role. So while stability has been restored, Nashville General is at a place right now where there's a lot of opportunity to grow upon that. So this next CEO needs to convert that stability into meaningful progress, rebuilding the trust, clarifying NGH's role in the Nashville ecosystem, and then strengthening the key partnerships and delivering operational excellence and access, utilization, and patient experience. So each of these candidates that's presented, we encourage you to evaluate them, not just on their resume or their leadership style, but judgment that they've shown, discipline, credibility required to lead a public mission-critical hospital in we've used the word fishbowl, but a highly visible political complex environment. So specifically what we've been evaluating candidates on for the CEO is somebody who is a battle-tested public hospital leader. They have proven success leading complex urban, essential, or public hospitals, and really have a deep understanding of operations, finance, quality, compliance, turnaround, execution. They also needed to have the political acumen and governance discipline. Somebody who's mission rooted, that was really important, business minded, that has a strong commitment to NGH's mission, safety net mission, and that has, again, that financial discipline, credibility, stewarding public subsidy while driving the volume and the growth. Also the repositioning and identifying who Nashville General is now and also what they can be, that vision. So ability to clearly define their role and their relevance in the Nashville healthcare ecosystem. And then relationship, partnership building. This has to be a low ego individual leader, somebody who could build trust and sustain it across all of the stakeholders and the relationships. Community embedded, need to be very visible in the community, trusted. They have to have a whole cultural competence, diverse, low-income populations with competence, and being able to have operational discipline and that culture of accountability. So no candidate will be perfect across all dimensions, but what matters most is how confident you are as you listen, that each individual convert the current momentum that is going on right now into sustained performance and restore external credibility. So, and leading them, NGH, into that next chapter. That's the goal.
A lot went into it, right? As you look at it, and the challenge of identifying leadership that can handle the majority of what we were looking for. So, any questions on that? And is that still that should be in line with what we've discussed and meeting expectations? Good. And then I'll ask Hasham if you want to give us a recap of where we've been in market and sharing some of the information and data that showcases the search to date.
Sure. Thanks, Mick. Thank you, search committee members, for taking the time to sit this afternoon or this morning. This was a national search. We hit the market hard. We cast a wide net for this. There are folks from Nashville or with roots from Tennessee all over the country. We wanted to make sure we didn't leave any stone unturned. And so what started off initially as maybe we find the perfect candidate, as we interviewed folks, we actually learned it's more about fit here. There's plenty of candidates in the market who can do the job. There's plenty of strategic CEOs. There's plenty of operational CEOs. You all are in a unique situation with a highly charged political environment, lots of relationship building. We were really focusing on a public, front-facing, strategic figure for you all, someone who can really go out there and rebuild things, take things in the right direction. And so going back to the wide cast that we net across the country, this was about 500 folks that we reached out to directly, both folks within our own databases, our own network, and folks that we networked with within our own organization. And so we had to whittle this list down. After being given plenty of interest, I'd say we had a high response rate, close to about 15 or 16%. Our average, usually FYI, is about 8 to 10%. So you all had a lot of attention, lots of good attention, but I'll also transparently let you all know that there were a lot of very highly qualified candidates who did drop out due to the current situation of Nashville and what they read online and what they saw. My role as a front-end recruiter, I'm that first layer in the process before Mick and Julie interview folks. My role there was to weed out folks like this. Are they really in for the challenge? Can they truly handle the task at hand? This is what really got us down to the list of about 45, 46 people that I screened and brought it down to the list that Mick and Julie are going to present today, down to the 9 folks that we have. Most of these candidates are folks that we had to generate. They're not all active in the market per se. But we did still do marketing, we still advertise. We have something called the Naylor Network that we advertised from, and it's a network of forums, corporations, other organizations, specifically in healthcare, that really allowed us to gain some additional visibility. And yes, while this did drive traffic, again, we had to do the work to make sure that you all had the right candidate on hand. So there were a lot of people who looked really good on paper. Again, folks who could have easily been plug-and-play candidates for you all, but we are not looking for plug-and-play candidates. We're looking for folks who will resonate with you all, fit in with your culture, your organization, and the city. And then 3, like I said, stay with the organization long-term and keep them headed in the right direction. So all that being said, we do have 9 candidates that we brought this down to. I'd like to reiterate what Julie said. These are not going to be candidates on paper who might look like, hey, this is the hospital CEO, and they've been a CEO. You'll see some unorthodox experiences here, but that's actually what's unique about these candidates. What appeals to us about what they bring to the table is that they've worked in a diverse amount of environments, different places. They can bring to the table the political savviness that's required here. They can build relationships with folks who are on the same side of the aisle as them or on the other side of the aisle as them. And they've done growth and development work both in struggling organizations and thriving organizations. And that's really what brought us down to the 9 that we're going to present today.
Excellent. Thank you for that recap as well. And to that point, I believe, if I've got the count right, Julie and I had interviewed 24 candidates. So 15 candidates that we did not move forward to presentation today. And what I would tell you is they're not eliminated. It's just we felt these 9 were the ones that could be highly for the position, right? So there's still work, there's still candidates. Nobody's been eliminated yet, but these are the 9 that we want to discuss today. Any questions on that, the activity, and our actions in market? All right. Very good. Well, we will go through the intent. We'll go through the candidates. We have 9 candidates to present. We have them labeled candidates A through I, and we will try to prevent sharing any information that is specific to those candidates versus generalities, but we want to make sure you get what you need to out of the discussion as well. So feel free to ask questions. After presenting the 9, it will be my challenge to the group to try to get that down to a manageable number for first round interviews. And my direction there is usually 5 to 6 candidates. And this is, again, as a reminder to you as a group, this is your time commitment, right? So that's a 2-hour scheduled interview. We expect it to last 90 minutes. If it's 5 candidates, that's a 10-hour commitment. If it's 6 candidates, your 12-hour commitment. We have dates identified for those interviews to occur. We know what that's going to look like already. But the challenge will be to get this down to 5 or 6. It could be fewer if that's what you, if that's where you end up landing. But my challenge will be to try to get it down to 5 if we can. And then after we've presented, the challenge to get it down to 5, we will have discussion, we'll deliberate. But I've got some ideas of how we can effectively get down to the 5, and I think we've talked about, once we've shared the information before there's any discussion, have you identify kind of your rankings, your top 5. We'll compare that before we have discussion. I don't want the discussion to influence, so we want to prevent bias in this. One thing that I do like about this with the redaction of information is it does eliminate some bias in the process, and I don't mind that. I just want to make sure you get as much information as you need to make an informed decision. So straw vote at the end of this. We can identify those that we know are going to move forward. We can identify those that we know we don't want to move forward, and then we can have discussion about those in the middle to get us down to the 5 or 6 we're looking for. Does that plan work for this group? All right, very good. Well, we will start with candidate A. This candidate, well connected to Nashville, to Tennessee, passionate about Nashville General Hospital, coming from an academic medical center where he was president up until 2023. This is a late career individual, highly decorated, And by that, I mean awards in healthcare for leadership, well published as well. In some ways, when you look at the size, scope, and scale of responsibility in the past, maybe an over-delivery of talent when it relates to size, scope, and experience that way. And drawn to this for a number of reasons. Nashville General, near and dear to this person's heart, but also wants to make a difference. And so this is somebody that is in a situation where there are not many opportunities that are going to draw them out and draw their attention to go to work. This is one of those that would be of high interest, and mostly the fulfillment of providing for a community hospital that means something to them personally. Julie?
Yeah, that was a great summary of this candidate, but mission-driven physician executive, decades of experience, strong Nashville roots, national credibility, and I think one of the reasons why we felt that he would be a strong candidate on this slate is he matched a number, if not all, of what the stakeholder objectives were. So what you needed most, whether that was the external trust building, the governance, the stakeholder navigation, the accountability of the academic partnership. So he brings big system operating experience.
And Hisham, anything to add?
I just wanted to mention that by experience, he has held operational roles, but he's been very much a strategic operational leader. He's leading operations from a more macro view versus being down in the weeds, and I think that's the difference in how he would translate his experience to Nashville General.
And lastly, I'd say I've got confidence in his ability to navigate the community politics, the relationships, the understanding of the players, right, and maybe a convener of that talent. So that I think I could speak with some confidence.
Yeah. And the other thing is that he has that deep experience aligning hospitals with medical schools and physician leadership.
Questions, observations, concerns about candidate A?
How old is he? Can't ask that.
Yeah, can't ask that.
Can't ask that. Nope. I was like,
An accomplished leader.
let me ask it this way. Is there a conversation that your team has had about the commitment level in terms of, let's say, numbers of years, or at least a time frame by which we would be interested in the contract? And I think that's important, not just because of age, but just really the longevity, if we're looking for someone for a 3-year window, 5-year window, or a 10-year window kind of thing. And I think that we may all have differing opinions, but I think that is someone who might come in and make a splash is going to be the different type of leader that's going to come here and maybe take up a longer runway. So did you have that conversation?
We do, and we do with all the candidates. And I'll preface it this way. So any work that we do, any placement we make, I'm always looking at a 5-year window. That's just my kind of guideline and rule, right? And I may have said this early on in this search and told you this. The first 5 years are on me. The next 5 years are on you, right? So it's got to be the right culture, the right environment for them to stay, right? But I always look at 5 years. It's 3 years to really affect any change. It's 5 years to see that through. And so when we're talking about the challenges that any leader is going to face coming into this organization, it's really that kind of time window before you're even going to get there. So my lens is 5 years as I'm evaluating candidates. We've talked to most candidates we've talked to, and one of the opportunities that's a challenge is, the thoughts of a new hospital at some time in the future. And my message to you is you're going to have to do some work related to that. You may not be there when they break ground, right? And we don't know when that will be, but if that's 7 to 10 years out, hard to plan for that, but you will have to do work in getting there. Nobody has shied away from that 5-year window and agenda as far as their work commitment to this opportunity. Other questions, observations, concerns?
I'm just happy that you have someone who has executive experience and then academic medicine so that they understand that this role, tying up that relationship between the hospital and the medical school, would be a natural swing for them. So I think I like that very well.
And let's not kid ourselves, that's one of the most important relationships, right, for this organization. You look at two of the most critical relationships, Meharry Medical College and the city, right? I mean, those are probably two of the primary, not the only, but two primary relationships. And again, that was part of the lens of evaluation when talking to candidates. Can they navigate and foster great relationships with those organizations?
I had a question about the employment gap. So it looks like the last time they were in full career was 2023. Did you address that gap and any concerns that have popped up since that? As we know, medicine advances and lots of things, technology advances very quickly. So that would kind of maybe be something I'd be interested in hearing more about.
We did, and I'll let the team speak to that too. So we spoke about that. And this is somebody since 2023 doing advocacy consulting work. So staying current, but not in a full-time role. And I'll use the words, this is one of those opportunities that would draw me back to work, is this one, right? And so somebody that doesn't have to work, but choosing to work for the right reasons because they feel they can make the difference. So, Asham, Julie, anything else that you?
No, you said it right, Mick. It was kind of doing consultative and advisory work at the moment just to keep themselves sharp until if and when the time comes to take on a role such as this.
He stayed very active. He's got national credibility through leadership roles, but at the national level, that are very impressive.
Sorry, last question on this candidate.
No worries.
And this will apply to every candidate going forward. I'd love to hear your comments about not just this candidate, but kind of future candidates, because we see some candidates, and I think even here at this hospital have had leaders who have had a medical degree versus PhD degrees. I'd like to hear your mindset, since you've done this obviously with other hospitals, about the differentiation of those roles and what the pros and cons are that would bring those types of educational and, more importantly, experiences to the table in our setting.
Tough questions, right? I mean, but it's a great one, right? And so when you think about clinical professionalism and administrative leadership can be two different things, right? And it's the combination of those can be really good. If you have a clinical leader that is able to apply themselves into the administrative leadership role, that can be a really good situation. The funnel gets really small as far as those that have that skill set. And so, I mean, when you go back to what has driven somebody into a particular career, there's reasons that they're drawn to being a physician. There's reasons they're being drawn to being a nurse. There's reasons they're brought to a clinician that don't necessarily line up with leadership. And so taking it that step further and the intentionality of leading, and I'm always interested when clinicians make that transition. What drew you to administration? Why did you draw that? This particular candidate has been in administrative roles, leadership roles, president roles for the better part of the last 10 years. And so that's reassuring. And so it's one thing to interview and draw that out in conversation. It's another with demonstrated experience. That combination's always a good thing. The last component of that is references, talking to folks that they've worked with, understanding their leadership style, their administrative capabilities, right? And so that's where we take the guesswork out of it and confirm it. And that might be why you're not seeing some of the candidates and you are seeing these candidates. But it will be a good question for the majority of this panel, to be honest, right? And so there is a big difference. And the other factor in this, and I'll go back to the lens of which we are evaluating candidates. It is one thing to run the operations of a hospital. It's another thing to have the influence outside and the leadership and skill set to influence. I'll break this down with one more step. Running operations when you have direct responsibility because you have the authority to tell people what to do, that's one skill set and ability. Service lines, I love service lines, and I love where health systems have gone to the service line approach, is where you have to influence within your own system where you don't have direct responsibility and authority, and get people to do what you need them to do because it matters to how the system functions. That type of skill set is what I look for in some of the executive leadership skills, right? So to run an organization like this, where you have to work with partners outside of the organization, you have to have influence to get everybody bought into what we're doing and how we're doing it. That's one of the original lenses that we went to market to identify. But it's a great question, and it's a very applicable question to the candidate pool and who we're talking about. Because there are others that came through nursing, came through up as a physician. Do they have the skill set to lead an organization?
At this point, have you only interviewed the candidate themselves, or have you interviewed others that they have worked with?
So the referencing?
Yes.
So I am intentional about understanding who the candidate is that I'm putting in front of you. So not only the interview, but I'm talking to people that they've worked with. I'm talking to people that have worked with them in the past to either confirm or maybe confirm some suspicions I might have, right? So we are doing those references. We are provided official references, and then I'm also talking to people that I know that they've worked with.
And this particular candidate, are those things confirmed by others?
Yes, yeah, we've gotten affirmation from others in the work that they've done. Any other questions on candidate A? All right, moving to candidate B. CEO experience from up until, 23 to 25, so up until 25. This is a candidate that is going to present well for the organization. They're going to represent the organization well, not only inside the organization, but outside of the organization. And again, CEO experience up until 2025. This is a candidate that is in transition, and it was leadership changes at their current organization that led to a mutual departure. Drawn to this opportunity for these reasons. He's got experience with county public safety net hospital and working with his academic medical center and bridging between those as a liaison to get them to work better together. Looking for his next opportunity, and certainly drawn to this for the mission and the purpose of the organization. And by the way, Nashville has played well for all candidates involved in this, whether they had ties to it, which most of them do. But if they don't, Nashville, from a healthcare perspective and optically, is a prime location, right? So that is something that we did not have to combat. He has reported to multiple boards in the past, and I would describe him as a strong operational leader, strong ops experience. That has led into to leadership roles. Maybe a little bit more reserved, conservative leadership style, not necessarily a bad thing, but that's just one of my observations in working and talking with him. Master's prepared. Another thing you'll see is FASHE, a fellowship in ACHE. I like that designation. It's a fabulous leadership program within healthcare, and it's a great program, but it also tells you something about that person's intentions. So something to not ignore. Julie?
Yeah, I mean, definitely he is a public-facing turnaround CEO. He has the experience of rebuilding community trust restoring utilization. He's been proven in politically complex, he said, multi-board environments, has proven experience, one of them with the proven financial operational turnaround under pressure, under scrutiny, highly visible, but he has very strong metrics about what he has inherited and what he's been able to do to turn it around. For example, he had a $30 million operating deficit, and he moved it to break even within 12 months. He moved the average daily census significantly, like the low 90s up to about 150, and then the market share. So beyond just that, he is a trust builder in skeptical communities. Is kind of how he has described his past experience.
Yeah.
So he's led broad community outreach across municipalities, colleges, universities, civic faith groups, and he has been and has served previously as the primary public face during those turnarounds. So almost like like we talked about, the being able to articulate the vision and what NGH is, he's very strong in that way, launching community rebranding efforts, getting out into the community.
Public hospitals?
Public essential hospital leadership experience. Long runway.
Can I ask, in his turnaround experience, was he already present in that community where he had that experience, or did he move? Because one question I have as we go through this process is, I think the skills that would be needed to do a turnaround are transferable from geography to geography. There's, but I also wonder, how important is it as part of that if the hospital is trying to rebuild trust with partners across the spectrum, whether existing sort of community knowledge is helpful. So do you know whether, I'd be interested whether he or any of the other candidates who have that type of experience came into a new community and were able to achieve that without having been there before?
So he'd been in that community with one organization for 16 years before moving into this leadership role for the last 3 years to move the meter. So probably knew the community well to be able to have that type of influence. But in the most recent role was hired in as the CEO to move that meter. So he didn't grow up within that organization, but was responsible for that change when brought in, if that answers your question. But the benefit of being entrenched in that community to begin with. Asham, anything else to add?
I think one thing I'll say, David, just regarding your question is this candidate in their last role was a regional leader as well. So in terms of being able to get themselves entrenched in geography and in certain communities, this person not only did it in different communities, but did it simultaneously within different communities. Not only in their last role, but in that over decade long stint with that system that you see from 2007 to 2023, these were various roles that this person had to relocate for and turn things around within the organization. So to answer your question, yes, this person very, very savvy, very able to not only navigate the complexities that come with that, but able to relate with these folks, the populations that they work with.
Does this speak to the description of trust builder? I found that very interesting, why that was used with this particular candidate.
Probably because he needed to effectively navigate what he needed to get, the results he needed to get. And so you had to build trust to get there. And I go back to this service line influence approach where you don't have direct responsibility, but you have to get people to subscribe to what you're doing. And so you do that through building trust, and I think that's probably where that came from.
Do we know why he left this position?
Change in system leadership, and it's not surprising, and this is the risk factor, right? Which if this is a candidate you move forward with, that I would probably talk more about, is when you bring somebody into a turnaround situation, they effectively do that. Sometimes that turnaround leader is not the same maintainer going forward, right? So that's one of those risk factors that you have to be cognizant of And if you interview, that's something I would probably ask you to interview for, right? I don't view him as a turnaround agent. There's many that we talked to that you're not seeing. I don't view him that way. I think he was put into a situation in which that's what was required, and he successfully navigated that. And then with change in leadership, they decided to, I don't know if it was eliminate the position or change the scope of that role, but they mutually agreed.
Yeah, it was a system level leadership change and a shift in strategic direction.
Yep, misalignment in strategy from where they were initially going, so.
Mutual alignment, a decision.
Which the misalignment in strategy brings us back to why this is more aligned with what he wants to do and what he
Right.
needs to do. And that goes to the difference between, I'll say, profit focus versus mission focus.
Agreed.
I'll just say that.
Yeah.
So, sort of same question as last, particularly when people are not in the role that they've been in anymore because of leadership change. Change makes me even more want to talk to people that worked around them.
Yeah.
And did you have such affirming
This is-
conversations for this individual?
This is one I will have to pursue further. Yeah, so this is the first time we've worked with this individual, so I don't have as much background and history there, but
Okay.
we still will need to do that work.
I'll also add one thing with his stint where he was there for from 2007 to 2023, what he did there also is he led the development of a medical center there. So like the construction from the hospital build and operational launch from scratch. So he has that experience, which I think would be useful as we talk about potentially building a new hospital.
I was going to point that out, so thank you. 64 million. He was not the CEO when they did that. He was in operations, which may be even more important because he would have been knee deep in the build out of that hospital. Other construction build experience as well, besides the build of a new hospital. Other questions, observations, concerns? All right, we'll move on to candidate C. Candidate C, I think, is somebody, this is a Nashville native, entire career, demonstrated success, escalation and responsibilities throughout the years, a nurse leader, mission-driven, strong clinical leader, been with the same organization now for 11 years. And then the two things I think that stand out, Nashville for their entire career, and then the progression during those years. And not just with current organization, past organizations as well. And a nurse leader, I think I mentioned that, RN by background. Julie?
Yeah, this person obviously has a strong commitment to NGH's safety net mission. Their operational leadership, strategic partnership has been very helpful in helping with the strategic partnerships and developing those even further. So she has passionate about what she does.
Only CEO experience is the current interim CEO experience. That's something else to, I think, to point out. Asham, anything else to add?
I think what I noticed in this person's progression in their career to get them to the interim role was their personal philosophy and mission and their passion towards that mission that's continued to shape the way they approach their leadership. So from going into an operational leadership type of role to a more strategic type role, this person's value towards patient care has to an extent driven that patient care, satisfaction, quality, all of that has to an extent led to the success that this person is seeing in the progression of their career. So just wanted to point that out, nothing specific, but it does make a difference to see someone who can lead with passion and mission versus maybe being more on paper and being the prototypical CEO or COO.
Yeah, more focus on organization than self.
Right.
Yeah, yeah. Yes.
I had a question in terms of your perspective around the kind of ability for kind of some of the other things I looked at that in candidate A and B. So as an experience with community interaction, where you felt like this person was in comparison to their ability to lead community interaction, to continue to build trust and be kind of a regional leader, and continue to be at a level of strategic soundness and strategic operations, as well as kind of leading both not just clinically but within the hospital. So I'm just wrote down some terms that stood out to me, and if we're comparing, I think that would be helpful to get your input on some of those things for this candidate.
Another really good question, and I think one that needs to be addressed, right? No, it's good. So this is somebody that has demonstrated clinical operations success. This is somebody who has not given you yet a window of what you're asking about, and that's the outside strategic, because they haven't been afforded the opportunity yet, right? So there's a small window of observation to date to evaluate that. To me, that is what I think you would have to interview this candidate for, right? Because the role and responsibilities to date have been defined within the hospital. The role and what we went out looking for is bigger than that, right? It's outside the hospital. It's the relationships. This is somebody that, from all accounts, has been able to build trust. So that's a key factor, right, in what we're going to ask the new CEO to do in building that trust. But again, a small window of observation to base that on. And so you as a board and search committee have to evaluate the risk of somebody that has not demonstrated that but has capabilities versus those that have been able to demonstrate it in the past or in their experience. But to me, that's the question with this candidate, right? Hospital operations, great. Is that the concern of this group going forward, or is it implied, right, that we expect hospital operations to run well? It's all these other factors that will lead to the success of this organization over the next 5 years. Those are the tough questions, right?
Last question on this candidate. I'm guessing you would tell us if you had further experience with them in other engagements. And then the other question would be to Dr. Martin's point about talking to other individuals and references and kind of kicking the tires on this candidate. I'd be interested in your comments.
Yeah, I mean, with purpose and general knowledge, I think what we've heard is effective leader for what has been asked to be done to date. And so we have done that. We have talked to individuals. We've heard people give positive feedback in talking about a strong candidate for this role. So we have heard that. But we've also, we'll go back to the dynamics that we're looking for that external facing leader, which still is a question mark that's not been answered. Any other questions, observations, concerns on candidate C?
We just have a comment. Given the candidates that we've talked to this point, it seems as if that candidate C has certainly gotten the credentials and training that surpass the others. I mean, so being ready and trained and the education to do the types of management and administrative things as opposed to kind of learning on the job. It seems as if that the other two.
Well, the other two have been president, CEO previously, so they've been there. But
But I
To
do-
this point, you've had a physician, you've had an administrator, and now a nurse leader that we're talking about. So all three different pathways, which is purposeful on our part. As I told you, we would bring you a diverse panel of candidates, right?
Yes,
From
yes.
experience, but you're
Yes.
right. I mean, and I
Yes.
would say clinical expertise for sure, for sure.
Well,
Operations, clinical operations,
Yeah.
yeah.
well, I do think that it's important to note that an individual chooses to do a significant amount of training. That's important.
Absolutely.
Okay, so
Absolutely.
that's all I'm pointing out.
Yes. Which I think is, when you look at the education as well, right? MBA, DHA, MS, BSN. Agreed. Anything else on candidate C? All right, candidate D. Tennessee roots, really strongly rooted in the state. Big system experience. 15 years with a large health system. And when I say large health system, I'm talking nationwide system experience. Early experience was defined by for-profit experience. I don't mind that. I like some of the discipline that comes with that when applied to healthcare leadership. Has been in nonprofit mission-based since then. So this is dated, but again, going back to early career. And I would describe this person as a positive culture builder. They have safety net experience, high Medicaid mix experience, well-rounded, currently not working in the state of Tennessee, and part of the motivation is this is a chance to come home and serve an organization that would mean something near and dear. And so, again, taking all of that wide breadth of experience and applying it to an organization that would mean something and have a purpose for this individual, that's the draw and why the interest here. And again, maybe an over-delivery of experience when you think about the breadth of experience and the depth of experience, but the motivations are sound with knowing the organization and wanting to lead this organization with a purpose to allow the organization to survive and thrive. Julie?
Yeah, I mean, I think that he, mission-driven, that is one of the mandates that we were looking for each of these candidates. Nashville rooted, again, a kind of a turnaround operator, somebody who builds that trust and those partnerships at the same time driving the operational and financial discipline that is needed in safety net, low margin environments. I would say that he's got experience with complex oversight structures, multiple boards. He understands, he's very good, I think, out in the public, understanding the political, financial complexity of a public hospital, the need for transparency. I think he would be a strong leader. And the other thing is, looking forward for facility strategy. He has experience with, again, major construction, facility planning, and service expansions.
What was his public hospital experience, and has he moved around a lot?
No.
The interesting thing is in the way that we have presented the information with the redacted information, he's been, as I said, he's been with one health system for 15 years, but different roles within that system. So without giving the name of the system, it looks like movement, but it's all within that same system. So yes, he's moved, but within the same system. And currently, he's actually responsible for 2 hospitals out of state, and is doing that in a hybrid situation where he has not relocated. And so part of the motivation is where you're located and serving this organization.
Yeah. It's 2 hospitals, 2 surgery centers, and 30 clinics in that geography. And he reports to 3 boards currently.
And this system he's been in, is it a for-profit system?
It is not. It's
Currently, it's not-for-profit.
Not-for-profit.
He has extensive for-profit experience before that.
And what is his last experience in a public hospital or safety net hospital environment?
That's what so safety net, but maybe not public. And I'm trying to find that where it was dated. I'll find that for you.
His career, though, began in safety net organizations.
Yes, which is probably before 2008.
Can you speak a little bit more about the alignment with Nashville General mission? Because of the candidates you've presented, a lot of their backgrounds, the positions they've held, very similar. I mean, what stands out to me that's from his is a couple of years as an IT and revenue cycle consulting firm, which is certainly valuable experience to what we do here, but it's a little bit, that stood out to me as somebody who's did something very different for a little while, and also raised a question in my mind of, you know, what is the passion for the mission or other experience that he's drawing on that aligns with our mission?
If we didn't hear it, if we didn't hear it genuinely from them, you're probably not seeing them. But I think the draw is and again, I go back to, there are many opportunities in healthcare in Nashville or the surrounding area. And he has specifically identified this where I think it gives him purpose and meaning in what he's doing. So he's able to effectively speak to that. But has he been in that environment? No, right? The question is it because of your location or is it because of who you are? And I think if this is somebody you move forward with an interview, you have to get comfortable with the answer to that. We are comfortable enough to bring this candidate forward, but I think that's where you would have to get comfortable. Is it just because it's Nashville, or is it because of the mission, the purpose, and who we are and who we serve?
And we asked him specifically what Mick just said, and we both walked away saying, okay, we feel confident with his answer.
He's one of the 9 versus one of the 15, right? So,
I guess I still don't, I see some very distinguishing characteristics of A, B, and C, but I haven't heard it about him yet. I mean, he has passion for the mission. He wants to move back to Nashville.
he hasn't moved from, I'll
Yeah,
just
he
say that, yeah.
Okay. And
He knows the organizations, he knows this organization, he knows the challenges that you're facing, and he's opting in because he feels like he can make a difference. It's one thing if you're, let's say, in Florida, and this looks appealing, and hey, let's go do that. It's another thing to be here, know what Nashville General's gone through, paying attention to it, being aware of it and around it, and saying, I think I've got a skill set and leadership skill that can make a difference, and it may be time for me to go apply that. That's where I think that's coming from.
Yeah, definitely recognizes where the reset NGH needs and the relationships and how to navigate that to get to where it needs to go. He also has immediate market credibility. He has very strong existing relationships across the Nashville healthcare ecosystem. A number of senior leaders. He could start rebuilding alignment very quickly. Already has that trust.
I have a question about the relationships. Is it the relationships with other healthcare providers, or have you seen this candidate be active and successful in relationships with like Metro and or other kind of community building? And then kind of to Dr. Martin's point about references is like, have you kicked the tires on this one as well? Because, I mean, I think being strong and being a leader in our healthcare system, which is very wide in Nashville, also can still be very narrow. And when you're building consensus around an organization like Nashville General, it takes all professions, all sectors, in all geographies. And I'd like to make sure that we always are considering that as part of these relationships. So just curious about your thoughts.
So knowing more information than what we've shared, this is probably somebody that's working in the periphery of Nashville, in the suburbs of Nashville versus the urban environment. Does that answer the question? Yes. Yep. I thought it might. Questions, observations on candidate D? All right, moving to candidate E. This candidate, mission-driven. I think it's something that really defines him as a leader. This is kind of his purpose. This is the space that he's worked his career in. He's had an early career in, I'll call it politics, but it's really more closely related to government. A JD, he's got health policy experience. He's a political navigator. He's a convener of leadership, meaning he's able to draw leadership from around a community city together for a common purpose. He's also got a calming influence about him, a relationship builder and a driven growth leader. He is somebody that does not rest. He likes the challenge of what's next, constantly kind of pushing forward. The one concern here is he's coming from an ambulatory environment, not an acute care environment, right? So that's a risk factor and something that you'll have to weigh out. But he has forged relationships, again, through kind of a smooth communication style that brings people together. He's got a long runway, the ability to restore trust. And I think some of the things that were pointed out, his current organization, he's taken them from 60 million in revenue to 80 million revenue. And during that time, he secured $30 million in 2 capital campaigns. And they've expanded services by 30%. So when you look at demonstrated growth, and achievement documented. The big question is applying it. And again, I go back to what we were looking for as far as leadership and skills, brings that to the table for sure. The risk factor is that acute care experience. Julie?
Yeah, I mean, strong operational leadership. He combines that with deep public sector governance, government facing. Out of all the candidates, I think he is right at the very top in regards to government facing experience in a really highly visible public complex environment. He is, I think, at the top with that and very comfortable in those situations.
He currently managed an organization with multiple sites, multiple clinics, is that?
Yeah, and he's acquired and grown them since he's been there too. And into, they were in 1 state, I think they're in 3 states and looking to expand to 5.
Yeah. And the capital fundraising, the service expansion, all of those at the same time where he was improving quality and access.
We don't know anything about how he's perceived by those that work in his organization, or?
I do, yeah, and I've talked to people there that, I'll give you one quote, best leader I've ever worked for. I think the words were best boss I've ever had.
And any information with academic medical institution
Tie
relationships?
Tie into it, yeah. So as the community health center, they have to work in conjunction with partners, right? So the public safety net hospital for him had been a strained relationship for years, for no other reason than egos. I will just say that. And he has been able to bring them into the same room in discussions in conjunction with the city to make those things happen, right? So again, going back to navigating similar issues, demonstrated success in being able to do that. And we'll be able to get into more details about that as we go forward. Hasham, anything else to add?
I'd get redundant if I said anything more. He's been there, he's done that, it's just a slightly different environment. But again, as Mick said, proven results is just a slightly different environment.
Presents very well.
I have a question about your experience with these types of individuals who are have a background in law and obviously are very engaged with policy. And I think we've had some conversations at the board level about how we could be leaving some money on the table and or being able to navigate the political environment better on the Hill. And I think one of the things that stands out to me about this candidate is that is a very different look and feel than somebody who's maybe more operational, clinically, or ambulatory focused. And so I'd love to hear if you've had experience with this type of background and maybe some pros and cons about those people in this type of, or that type of person, if you will, that type of education maybe, in this type of environment, in this role.
Yep. So I think as we started and we talked about who we went to market looking for and what the organization needs, what we heard from you, and it's this outside facing, right? This is somebody that has been kind of built for that, right? As you said, trained, educated, and purposeful about navigating into that in that leadership role and demonstrated success in it. The flip side of that is, and going back to hospital operations, I don't say I take that for granted, but you need a team then to focus on that when you have a leader like this, right? And there's an assumption that that team's in place doing that. So the hospital operations, I don't want to say it's secondary because it's primary what we're doing, but the leadership and making sure that is functioning can be done and supplemented through leadership talent. This skill set that we're talking about is the unique driver that would define the organization and who they are outside of the organization. So I think it's a very good observation and purposeful. Some people go get a JD to practice law. Some people go for politics, right? And I'm not even saying this is politics versus health policy, right? Did it with a purpose, with a mission involved. So there's personal drivers as to why to go represent these communities to make sure that they are served and not taken for granted. And that's this individual, what has driven him for his career. This wasn't on purpose, but I'm sitting here thinking about it. You've got a physician, you have an administrator, you have a nurse, you have an attorney, and again, there's purpose to this. And
Right.
I'm kind of chuckling because I didn't realize it until we're sitting here presenting the candidates. So, yeah.
So this clinic system that he is managing is for underserved communities?
Yes.
I mean,
Yes.
it's an FQHC, it sounds like.
Correct.
So
In
he
an urban-
manages a large FQHC organization.
In an urban setting with the same population that we're serving here. Questions, thoughts, concerns on candidate E, right? Candidate E. All right. Moving on to candidate F. This is a healthcare leader that has been through the course of his career responsible for leading hospital organizations that range in bed size from 25 to 600. This is also a FASHI fellow in ACHE. Has had essential hospital public safety net experience. And I'll just go ahead and tell you because it's not current, it's dated, but has experience at Cook County and Erie County, in Chicago and Buffalo, respectively. Those were operational level experience, so not as CEO. The most recent position was a CEO, but it was not the CEO of a hospital. It was over an ambulatory service line. But large revenue, multi-state ambulatory footprint. Strong operator, I would call a stabilizer, has the ability to influence, brings a combination of both ambulatory and acute care experience. And then my last notes that I jotted down, sustained community impact. I like that. I think that's something that he pointed out that he has been able to do. And I would describe him as a focus on turnaround. Julie?
Agreed. He is deep experience leading, repositioning publicly visible safety net in academic hospitals. And he does that through that external trust building, the political fluency, the disciplined executive leadership style that he has. As Mick had said, with the Cook County Health and the Erie County Medical Center, both of those operating under county ownership. They were elected officials, union environments, under intense public scrutiny. So I think that aligns well with what we're looking for in regards to NGH's governance reality right now.
In an operational leadership role there, not as CEO, just to make sure that we have that distinction. Hasham?
I don't think I have anything to add to this candidate, actually. I'm good, thank you.
What is he doing now?
He had just left recently from the CEO position over
System reorganization.
an eye optical practice, which was part of the same system where he held a leadership role. So he was asked within the same system as a EVP to move over and lead as CEO over this optical service line. I'll call it that.
And he's currently employed, or?
He is not, so he is not. He is
And
in
do we know why he
transition.
left the organization?
That was a restructure, so that service line that he was asked to lead was then incorporated back in where they eliminated that leadership position.
The duplicate, executive roles,
So the same organization for 2 years held two different positions, and it may have been one of those as they were consolidating, which I know they were, where they found that second opportunity for him to not have to leave the organization, which unfortunately still led to him leaving the organization.
Yeah, he was recruited to this academic medical center, and then he was leading this specialty service hospital, we'll call it, in a senior system executive role. But it was within a large academic health system.
It sounds like he has been in environments that there was a lot of scrutiny. I think you used that term and
Yep. Yeah.
emphasized it. But as we discussed before, there's an internal operational component when you're operating under scrutiny, and then there's a public-facing component of it. Can you talk about candidate experience in a scrutiny environment, and is there any proven track record of managing that externally?
And that's the fair question of which I was alluding to earlier, right? Operational leadership roles in public hospitals, where maybe you're not in the white hot spotlight at the time. I'll give a little bit more backdrop. This is somebody that played professional sports. And so there's glimpses throughout the career, and there's organizations they've worked for and positions they've held which speak to the ability to navigate that environment. But to answer that question, not having been in the CEO seat when having to face that type of scrutiny, that's true. But there's enough there to I think, demonstrate that they could. And they have, just not at Cook or Erie in that point position. I hope that answers the question. Yeah. Other questions, observations, concerns? All right, we can move on to candidate G. Candidate G. First thing I wrote down was all Nashville. Public health, politically active, involved. I would say, focused on the mission, focused on the purpose, up for the challenge. Again, this is a candidate all ambulatory experience. And so a lot of physician leadership, a lot of physician group leadership, but the lack of that acute care experience. So again, that would be a risk factor to consider. And this is another candidate, the way that we've had present the information could look like a lot of movement, but again, it's also for the same organization, right? So again, within a system, different roles, different responsibilities within, and a physician leader. So going back to that, this is somebody that we feel, and through other conversations, would be positioned and have the ability to restore trust. That would be something else that I would say about this candidate. Julie?
Yeah, in my notes, Nashville-rooted physician executive coalition builder with strong regional credibility across the competing health systems here. Deep crisis leadership experience, and he has CEO adjacent experience or scope, enterprise scope. So clinical service line, business development, positioning. NGH is he considered a citywide gem that doesn't need to, it doesn't necessarily, it has the ability to not necessarily rely on the recurring metro subsidy to stay afloat, being able to help so that is not so dependent upon that.
And not to be ignored, I think something that I'd point out here is leading physician groups and the organizations he's been with. I think developing further the relationship with Mahari would be implied there. There's a skill set experience of working with those groups that I could see would bring some credibility to the relationship with Mahari. Hisham?
There were concerns brought up earlier about how physician leaders might transition into administrative roles. I'd say this candidate has done an excellent job of going through this double or triple filter between myself, Julie, and Meg, and proving themselves that, yes, they're a physician leader. Yes, they work extensively, boots on the ground with physicians and other leaders, but they can also navigate not only the complex system environment, but they're in an academic environment. They work with vulnerable populations, and they're very familiar with the current landscape of the Nashville healthcare market. And I think that having knowledge and experience within Nashville specifically, I think will take you all a long way with candidates, because you all are unique. You're not Cleveland, Ohio, or Pittsburgh, Pennsylvania. You're Nashville, Tennessee. And so having someone with familiarity, roots, extensive experience entrenched within Nashville, I think that goes a long way, and this candidate does bring some of that.
Good runway, too, as well.
He's heavily strategic, external facing. I mean, if you were to partner him with a strong COO, CFO, he governs, he owns the governance piece of that, the partnerships, the position alignment, the market credibility. It's a dynamic duo.
But a needed complement. But a needed complement. Yeah. Questions, observations, concerns on candidate G?
Has this person had demonstrated experience with working with Metro and our other kind of governmental partners?
From our understanding, yes. Yep. The other observation maybe that we haven't pointed out, not been the CEO. I think that's on there, but I will point that out.
Just out of curiosity, and I think there's been maybe one other candidate or so that has not been the CEO, candidate C. they wouldn't be here if you didn't think they could be the CEO.
100% agree. Yeah, yeah.
They've just, in your mind, just to reiterate, you just don't think they've been given the opportunity. So the question I would have is that, has there been a conversation around, is that even an option in their own institution? Because several of them had continued to move up and been a rising star, obviously. Or are they looking to shift because of the mission and the specific place that Nashville General was in? So I'm interested in that comment, but then also maybe to track just a little bit to your initial comments about having a wider candidate pool, but having several of the candidates, many candidates actually, I think is the term, who decided to opt out based on what's going on in Nashville. So I'd be interested to hear specifically, is that politically, is it specifically because of Nashville General itself? So I'd like to hear that comment specifically as well.
I'm going to answer the first part. Specific to this candidate, I think you were asking about CEO experience, the different, I won't speak to previous candidates that we talked about, so I'll stay focused here. We certainly see this person as the structure of the organization that they're currently in would not afford them the opportunity to be the CEO by title, just because of the organization and the way it's structured. So that would have been the only preventing factor. In the current SVP role, probably has the significant amount of leadership experience that's needed. The driving factor here is not the title. The driving factor is the mission of the organization and the ability to affect change and help this organization move forward. That's the draw and the drive for this particular candidate.
Yeah, how does this candidate meet the 5-year
Oh, yeah.
desire?
Yes.
Okay.
Yes.
And then Christy, regarding your second question, transparently, at least from what I'm seeing, it seems like it's the politics. Your organization has appeal. There's a lot of potential. Folks are seeing the opportunity there, but they're also seeing the media part of things, and that's what's pulling them back. There's only so much I can say before they say, I've seen what I've seen online, I've read up on it, and, you know, it's a bit of a messy situation. So it's not your organization per se, but it's kind of the political environment that may have led them to, may have led to where things are. And so those folks, yes, they have experience in political environments, charged environments, and working with vulnerable populations that need some of that attention. But I think it also comes down to, I've been there, I've done that. Do I want to go back into a situation like that where I'm putting that type of time, effort, and energy into kind of, again, doing what I've done maybe a few years ago with my current organization or done in the past? I think some of these folks want to go to a more growth or development type opportunity. Not that you all don't have that, but there's still work to be done in terms of potentially turning the ship around before you steer it in the right direction. So that's kind of been what scared folks away, is just more so media, what they're seeing in the media, the articles that are coming out regarding
The public aspects.
Right.
That's really what it comes down to.
And just to clarify, to be crystal clear, are you talking about our previous CEO and the relationships or broken relationships, let's say, between previously with Meharry and the Metro, et cetera? Or are you talking about more of the high-level state type of political environment that we seem to be in, even down to our mayor's office? I just want to be crystal clear that we're talking about, is it you don't want to move here because you don't want to be in Nashville, Tennessee political issues? Or are we talking about let's call it the previous drama that existed here?
It's
It's a little bit of all of it. It really is. And I'll distill it down to this. It's the public aspects of who the organization is and the public lens in which you have to work. And you can't avoid that. So when people see, insert any one of those situations, and if a candidate's concerned about the public visibility, scrutiny that comes with that, maybe there's other organizations where I don't have to deal with that aspect of it. And that's where it comes in. So I'm going to take one step back further. These were probably not candidates that reached out to us expressing interest because they didn't know who Nashville General were. It was us reaching out to them to gain their interest. And then as they researched and pursued it, it was, maybe I don't want to, I don't want to sign up for that. So that's an important distinction as to why, right? It wasn't coming in and then discovering, okay, maybe this isn't it. It was us trying to draw their attention to it with them saying, probably not the public aspect for me.
Great. Thank you.
Any other questions, observations on G? All right, moving on to candidate H. Here's how I would describe this candidate. Very strong operational leader, has held the number 2 role at a public safety net essential hospital. MSA, MBA, BSN, so this is a nurse. Held the SVP of Ops position for a 500-bed safety net hospital. Nurse leader. She had recently left her organization in January, and that was based on personal reasons, which we can share, but understandable, appropriate dynamics that took place personally. I did, Dr. Martin, to your point, I did do an off-the-cuff reference. I wanted to talk to the person that she reported to, verified what we had learned, disclosed that this is somebody that was pursuing this position and advocated for their abilities to lead this organization. And so there's a little bit of groundwork that's been there. Why this, for this candidate? Opportunity to be in the number 1 role to lead an organization like this. The other thing I would note, I thought was interesting, if you looked on some of the experience, attained the certification from Harvard for managing healthcare delivery for executive leadership. Really good program. I've seen a lot of hospital leaders that have taken that program and speak highly of it. Strong operator, low risk. And then I want to address Christy before. This is somebody, again, I think that you have to look through the lens of how will they represent outside. So very strong hospital operator, no doubt that we can run the organization. And then how do they navigate the politics outside of the organization, and how well do they do that? I don't have concerns, but she's also been not asked to do that yet. Right, so can she do it, and does she want to do it? That would be the watch for if you interview. Julie?
Yeah, I mean, my notes, public sector, safety net operations, quality executive. She's repeatedly been selected to stabilize complex hospitals. She's driving cost discipline, regulatory performance, turnaround, execution in politically visible environments, which I think aligns with what we were seeking with this CEO.
Strong quality background as a nurse. I think early career was defined by quality.
Yeah, significant experience working within public governance and external scrutiny. And comfortable with that, didn't shy away. Some candidates do.
There's some Teflon there, yes.
There.
For sure. Asham?
Yeah, I'd like to point out that in this person's last role, they were with a county-owned hospital. But aside from that, which is great experience, the 2 roles before that were very tough situations, very vulnerable populations, struggling organizations, and this person went in and turned things around before being recruited away. And this is actually a general theme that I think applies to most or all of the candidates here. But if you're being recruited away from most or all of your roles, it's a great sign. You're not a job hopper per se, because I mean, it's not always the best that you're jumping on the next opportunity, but for someone to say I've been recruited everywhere because of my success, it goes a long way, and this person is one of those candidates. And then the second thing to point out, and this applies to the 1 or 2 other operators that we had as well, it's tough for operating leaders to convince us 3 that they are ready to make that shift towards a more strategic role. I'm that first filter. this person convinced me, I pushed this person forward to Mick and Julie, and they had the same feedback. So I think in the end, despite by title, this person not having necessarily done the role, this person has been there and done that in terms of environment, in terms of the operational work that needs to be done. And the passion behind this person and their mission alignment with NGH, I think going back to what I mentioned with other candidates, it's great motivation to make them learn things that they may not have done. And this is kind of the thing that pushes them to become the next CEO that they want to be in their career. And so that's kind of the passion I saw come from this candidate. I think it goes a long way.
8 years in the last role before the transition for personal reasons, and it almost, if that didn't occur, it's probably that somebody that still had advancement opportunities in our current organization. So, questions, observations, concerns on candidate H? We're already to H.
I have a question about difference and after we go through, we're almost through with the candidates.
Yes.
Is it appropriate at that point to, we're going to vote, I'm thinking on these, right?
Yeah, we'll do just as.
But is it fair to compare and contrast? So as an example, we have a nurse, and I'm just throwing this out here, but we have another candidate who has a nursing background.
Yep.
Similar type of structure where you don't have the outward facing, you know, if my head naturally goes to compare contrast if I have similarities. So you start eliminating based on these things. If I've got two medical doctors, for
Right.
instance, or I've got this or I've got that.
Which one's better?
Right?
Yeah,
Which
yeah.
one's better? So that helps me narrow my and filter.
In that category, right.
So I guess the question would be ultimately is it an appropriate time now, or should we wait till the end, Chair Escobar? Or two, if it is appropriate, like do you feel like are the pros and cons of the mitigating factors between candidate, let's say, C and the candidate H? So I don't know if it's the appropriate time, but I just want to bring that up.
Let me just preview what we're going to do after we hear about candidate I. As Mick suggested, we're going to take a straw poll. I mean, now that we have gone in depth and heard about the candidates, so each member of the committee is going to independently list the 5 candidates that they would like to see brought back. Our goal is to get to 5 candidates for the next round of interviews. What I hope and expect, we all hope and expect, is that there will be one or more candidates that will be unanimous among the 5 that don't require further discussion. I also would expect that there will be one or more candidates that will not appear on anyone's list, or perhaps one person's list, and we can have some discussion. That will lead us to a group of candidates that we will have some more extensive back and forth about, with the goal of achieving a consensus among the members of the committee of the 5 people to bring back. Knowing that after that discussion, if there is not consensus on 5, we can move to 6. And I think that would still be a manageable number. So just that's the preview of how we're going to do it.
All right, you keep putting me on the spot, but I'll go ahead and answer.
So, Christy,
I'd like it,
were
but no,
you asking that whether we can compare 2 candidates from similar vantage points? So, what's this RN have over another, or what's this physician have over another? I mean, I personally think that we're kind of beyond those labels, and that we just need to evaluate what they've done and what their qualities are. And
I'm just curious as to people's thoughts.
Yeah, philosophy behind this, as I said, our goal is to bring you a diverse slate of candidates that contains diversity, right, in it. But I think you're probably picking up on this team. There's a purpose in which we're bringing candidates forward. So the contrast and compare will come. If it's not now, it'll come at some point. But it's a fair question to ask. It's just when's the timing of that. So
I have a question about, I know you mentioned 5. If we apply rigor to what we said about executive experience, CEO experience, operational excellence, strategic leadership mindset, able to navigate the politics, and we end up with 4. Is there magic to 5? Could it be 4 or even less?
You could do 4 if that's what the
I'm just
consensus
saying.
is and comfortable with. Yeah.
Okay.
If it gets to less than that, and here's where me and the team might interject if we feel like you're missing something
Okay.
because of the format in which we're presenting information, we will speak up. Any other questions on candidate H? All right, candidate I. This is also, it's interesting because I'm going to start by saying this is a BSN, MBA, and fellow. By the way, the last candidate was also a fellow, ACHE fellow. I'm leading with BSN, but in all my interactions, I wouldn't describe this person as a nurse leader. I would describe them as an administrator operator, but rooted in those core, groundwork as a nurse early career. So 11 years with a health system in the South, moving to the North in a president role in a northern state. And I think for personal reasons, probably open doors to looking at other opportunities because of that. But specifically to this, looking comfortable with the visibility of the role, brings leadership, and then here's the focus to this organization, and I love that he said this. The complexities of an underperforming organization in which I can make a positive impact and influence. And so I think that's the draw and why this. Both ambulatory and inpatient experience. This is somebody with a more traditional career path when you look at clinical work early in career, moving into operational roles, escalation into operational leadership roles, and on the way to CEO. Currently at a 170 plus bed facility. When brought in, it was the lowest performing hospital within that system. And in just a short couple of years, it's one of the top performing hospitals in that system. And so going in with a purpose and a focus, and I wouldn't call it turnaround as much as a lift. I would call it that more than I would say it was a turnaround. It wasn't that it was poor performing, it was just lower performing within the system that they were part of. Julie?
Kind of piggybacking off of Mick's word, but hospital, not turnaround, but hospital lift. I would describe him as that system integration leader, somebody who has consistently delivered measurable gains, whether that was in quality margin, patient experience. He brings strong physician credibility, execution discipline, and he said to complex, growth-oriented environments. I would say that in his current role, he has successfully shifted the culture from an independent hospital to a system mindset, which I think that is, again, a key for NGH's partnerships and alignment needs. I think that aligns well. Again, a strong candidate. Leadership style is grounded in patient-first philosophy, but at the same time has that drives measurable improvements across the board and comfortable in public, high scrutiny environments.
This person is currently part of a not-for-profit, FYI, joined from a for-profit due to, again, mission alignment, as many candidates from the for-profit to not-for-profit might suggest. So this person did join for working for the people, not the shareholder, as I'm quoting that person. And Julie, correct me if I'm wrong, Mick and Julie, correct me if I'm wrong, but during that tenure with the for-profit, worked with the county to get a hospital up and running. And though it took a long time, I think it took almost a decade for them to do it, this person did get it up and running, working heavily within and externally with the community. So excellent experience. I think it's just a matter of, is this person going to bring that same stuff to the table and do it in Nashville General's environment versus the last couple environments they've been in.
Couple of questions. One is, why does this person looking for change? And two, is this person having experience with, say, dealing with community partners and that kind of thing?
I think as Sham addressed the community partners in trying to get that hospital launched, where it took county involvement. The health system that he is part of now, I would describe as essential safety net. The hospital that he's responsible for is part of that system and not in the urban setting of what I just described. So I think that's a distinction. And then was there another portion of that question? That was it, okay.
Is the current hospital a teaching hospital?
The parent.
Yes.
The parent is, yeah, the parent hospital is, the flagship hospital is, yes.
He also oversees in that current role the physician health organization. And that's kind of, I think, 25 outpatient sites of care, a couple urgent care facilities, and then several joint ventures.
It's an interesting candidate because it's one of those ones, as we as a group, as we're evaluating, I go back to the comment he made about the complexities of an underperforming organization and having a positive influence and impact on that as kind of a driver. That's probably the reason he's in this, and in for discussion versus some of the others that aren't. You couple that with, like I said, this more traditional rise through leadership to where he's at. It equips him well. It takes out risk when it comes to the operational responsibilities, right? And leading an organization like this. But then you want to make sure that the mission and the purpose are there. And he says so. That's where I think in interview, if this is somebody you want to meet with, that you have to understand, believe that, and get that for yourself.
Have you found through your interviews with these candidates differences in some of these turnaround stories, people's ability to execute in a more rural or kind of subsidiary to a larger city comparative to urbans, because working in an urban environment and moving money around in a county for Davidson is very different than moving money around in Cheatham County. So I guess the question I would have is, we see the states or we see if they're local, but I think that is something that would be very interesting to me to be able to understand. It doesn't mean that people can't do it, but just having a proven success record at those levels, to me, it's a very different, at times, skill set.
Probably half and half as you look at this candidate panel, where they're working in an urban setting that maybe provides less risk, right? Because they've worked in it, they get it, they understand it. And then going to this is an interesting candidate that way, because Parent Flagship is in a large urban setting where they're the safety net hospital, but he's CEO of a community hospital. That's part of that. So you get exposure to it, but he is not asked about the funding for that in the urban setting, right? So it's a legitimate question, and I think you'll see, depending on the candidates that you decide to move forward, we can provide more clarity on that. But it could be a risk factor with maybe 2 or 3 of the candidates. I say risk factor just because they haven't done that in that environment. Not that they're not capable, right? Any other questions, observations, concerns? If not, it's the fun time of identifying who you want to move forward, right?
Yes, let's do that. We're going for an hour and a half or so, and I think probably be good to allow people a chance to reflect on what we've talked about, what we've heard. People want to get something to eat and need nourishment. That is also okay. So why don't we just take, 3 3 or 4 minutes for people on the committee, for the committee to consider your top 5 candidates. Or if you don't have top 5 candidates and have less, then also let us know that. But we'll take a few minutes to consider that. People can stretch their legs, and when we come back, we will each identify who those are, and then we'll move forward from there, see where things stand after we hear from each of the committee members.
Complete one sheet.
I'm sorry.
We have multiple sheets.
Oh, I have not. I'm sorry. I didn't see the sheets. Oh. Okay. If you will. All right. I think it'd be. Can we just do that? Like, use your sheet if you want to, and then let's just go around and say, yeah. I did not see the sheets before, and we will go to the sheets if we need to at a subsequent stage. How about that? Do you all mind if we just take 2 or 3 minutes and people who want to eat and then come back and do that? Great. Thank you. Dr. Martin.
Sorry, Dr. Martin, can you say the first ones again?
Dr. Nzarue.
I have candidate A, C, D, and G.
Dr. Miller.
A, B, C, E, G.
And I have candidates A, B, C, G, and E. So, by my tally, there is all of the committee members would like to move forward candidates A and C. There are no votes to move forward candidates F and I. And then I will say all committee members but one would move candidate G forward. Otherwise, we have a mix of between 1 and 3 committee members who would like to consider candidates B, D, and H, and E. And B and E have 3, D has 2, G has 4, H has 1. So at this point, I don't think, unless someone wants to further discuss, there's a need to discuss the candidates that no committee member has wanted to move forward. By the same token, I don't think there's any need to discuss the candidates that every committee member would like to move forward. And
Those are the ones that everybody, those are A and C.
yes,
Okay.
and G
Sorry,
had
G
four-
had 4 out of 5.
correct. B had 3 out of 5.
As did E, had 3 out of 5.
Correct. So at this point, Mick, if you have a suggestion as to how to go from 2 to either 4 or 5 candidates, maybe we start that way. I'm open to suggestion as to how we do a discussion and try to reach consensus on a slate.
So G had 4 out of 5. Dr. Nettles did not vote G. Are you okay if we included G in the top 3 as far as?
I just selected 4.
Perfect, okay. So then that would leave candidates B, E, and D for probably the majority of the discussion. And candidate H got 1 vote. Does anybody else want to either advocate or push for candidate H?
Candidate E intrigues me. So candidate E is the person who has been very, very successful in pushing forward an FQHC, which is not a hospital, but from a demographic standpoint is as close to what we do as possible. I got a sense from what you said that this is someone who's a real leader, anyway, that's what I took from what you all presented.
Yeah. And
I would like to also advocate for candidate E.
Okay.
Because I was really struck by the what's next and the challenge. And I think that that's definitely the type of energy that we need to bring into this situation.
And I know candidate E and would be energized by that challenge. And the other thing I'd add is when he joined his current organization, there was a very similar dynamic that was going on where there was turnover, there was CEO turnover, and there was this public perception. And so he joined that organization at a very similar time of what we're talking about here with Nashville General, and has completely changed that in the 5 to 6 years of leadership there. Candidate B also had 3 out of 5 votes.
So if we were to go from the ones that had the most votes, it would be A, B, C, G,
And
and then if we want to add E.
E would be 5. A, B, C, G, E, that would be 5. And then D had 2 out of 5 votes. So candidate D would be the one for further discussion, I think. And then would you want to have 5 or 6 candidates? I think that's maybe the question posed with candidate D. Yeah, so A, B, C, G, and E would all have 3 or more votes. Candidate D has 2 out of 5 votes. Would be a candidate number 6 if we were to look at it that way.
Maybe a place to do that, if we're just looking at the tally of votes and the majority, who achieved a majority, then D would be, I think, the one to focus on as to whether we wanted to expand to 6 if we go that route. And Dr. Martin and Dr. Enzarue, you all expressed a desire or voted to move them forward. Do you all want to talk about that candidate in particular and how strongly you feel about including candidate D?
So what struck me about candidate D was the combination of for-profit and non-profit experiences, the safety net, and then the fact that they were well-rounded. Those are the attributes that made me select them.
So just to be sure, we're talking about candidate B as in boy?
D as in
D
dog.
is in dog, because that was the remaining candidates under consideration received at least 3 votes from committee members, and candidate D would receive your vote and Dr. Nzarue's vote. So I wanted to see from you all sort of what your reasoning was and how strongly you feel about including candidate D among the pool.
All right. Okay, candidate D is finding out more about candidate D is attractive to me because candidate D knows Nashville General Hospital, knows our medical community to a certain extent, and I agree that I have seen for-profit people with for-profit experience move into non-for-profit hospitals with good results. We have a lot to learn from each other. This one was described as a culture builder, and even though in a for-profit system has experience with safety net hospitals, and understands the political situation locally. So that's why I advocated for candidate D.
Let me ask this. What is the committee's willingness and appetite to conduct the next round of interviews with 6 candidates. I don't see a downside. We've talked about narrowing this group that's been presented to 5 or 6, so we're within what we thought where we might be. And I think the main consequence is that it's going to involve likely at least 2 full days worth of work for the committee. And if that's acceptable to the committee, the simple answer here may be to move forward 6 candidates. Let me ask that first and then get Mick and Julie and Hisham's view on that. But what is the committee's view about that?
Well, my concern is the exposure of these more than the 3 candidates. I think that puts stress on both sides for everyone.
And when you say exposure, what do you mean?
Wouldn't that be the point where we would bring them in and we really have to, now this is de-identified, right?
Yes.
This would not be another de-identified situation.
It would be. So yeah, let me clarify that because I want to make a distinction. I probably misspoke earlier because of the format that we typically use. The format this time is going to be a 1-hour session with each individual board member. So 5 candidates is a 5-hour commitment by board members. 6 candidates is just a 6-hour commitment. And we would keep the anonymity of the candidates through this round, so no further exposure. From this 5 or 6 that you interview, identifying 3 finalists, and when they're finalists, then the gloves are off. Then they're meeting with everybody, and it's a public, announcement of who your finalists are. So I want to make that distinction that this is just adding 1 hour of interview time for each board member, not the 2 hours.
Great. Okay. You're making the sell very easy.
I would go with 6 candidates. I think to go with 5 is a little bit arbitrary.
I like the fact that you go with 6 and then you reduce to 3.
Yes.
I like that math.
Dr. Nettles, Dr. Martin, is moving 6 candidates forward acceptable to you all?
I'm good with 6, but it's not clear to me who the 6 are.
Oh, the 6 would be A, B, C, D, E, and G.
I got it.
So take
I'm
a moment.
okay.
Dr. Nettles, you're
I'm
okay. I said it as sort of the burden on the committee, and it's not a burden. This is like we're eager to be involved in this process because of its importance. I think that Dr. Nzarue and Dr. Martin, your comments about the candidate who has for-profit hospital experience and can translate is important because 6 gives us more diversity. And each of these candidates comes from somewhat unique backgrounds and are going to offer different things to this position. So I also like 6 because it gives the committee a really complete range of prior experience, skills, talents. And so I think that's to our benefit to have as many options as possible, not just the sheer number, but the diversity of background and skills.
These are going to be a combination of virtual and in-person 6.
These are going to be in person.
All of
If
them,
we,
all 6,
if we, I mean, if we need to accommodate someone, we will. But our desire is for the 6 candidates to come in at the next stage, and they will have one-on-one discussions with each of us as a committee. Each of us on the committee will have an area of focus to talk with each of the candidates about, so that we don't duplicate the same conversation and ask these candidates to repeat several times. So we are going to divide up areas we want to ask about. We'll conduct those interviews in person. And then when we meet next to refine that down to 2 or 3 finalists, each of us will come back to the committee with our impressions, having met each of the candidates, and we will then go through a process to move to the final list.
Could I ask our consultants with that choice? Are we missing something important?
I looked at it. I think you've got a good panel. And what I like is, going to David's point, the diversity, we're maintaining the diversity of the panel too, right? So you're seeing different backgrounds, experience, pathways to leadership, with physicians, RNs, administrators involved in this. So I like that. Clarity on what the structure is going to look like. We have 3 days identified that are already being held. They're all Fridays. The ideal situation, we would bring in 3 candidates on one Friday, have everybody rotate, meet through each individual through the course of that day, and then the next Friday have 3 candidates come in. We can keep that third date as a buffer if any candidate is not able to make it or any board member is not able to make it. We can then have some flexibility in that scheduling, but it would be 3 candidates. And how many board members, search committee members? 7?
Well, at this stage, it will only be with the committee members, so there'll be 5.
5,
Will
that
be
makes it easier.
Yeah, we'll do 3 candidates. We'll meet with 5 committee members each day.
So you have a 3-hour commitment, the candidates have a 5-hour commitment for each one of those days. And we want to make sure, I want to make sure committee members think about that, to make sure you get what you need out of the interaction. 1 hour one-on-one should be plenty of time. If we did it as a panel, it would be a 90-minute interview. And the one thing I want to make sure that you build into that 1-hour discussion is allow the candidate time at the end to ask you questions. That becomes more of a discussion, right, than an interview. And just make sure you build that in and take that into consideration. And as we schedule it, we should probably provide some buffer in between to, if it goes beyond 60 minutes and goes to 75 minutes, that sort of thing. So we'll try to build that into the course of the day.
And these will be here?
Yes,
We have room?
we have.
And will there be any type of tour of the hospital for them, or?
Confidentiality still, so I would say they can be here. I don't mind if you do those interviews off-site, to be honest. Then the candidate's not coming into your facility, visibly into your facility, right? So you could give some thought to doing that at an off-campus site, or you could do it here, as long as we can. And one of us, if not both of us, will be here to facilitate those interviews. We would be here to shepherd through the day, to allow that to be easy for committee members and for candidates.
Where have you done off-site, like hotels or something? Or?
Yeah, or another office building, another medical office building. We've done that just where we know there's less visibility of walking into the main hospital. So
Yeah,
just some
let's-
thought to that.
Yeah, we coordinate that separately. I think my thought is for the ease of the committee, and something about being in this setting is important. If a candidate felt uncomfortable walking into the hospital, if they were so well known that the paparazzi is following them around everywhere, or if they have relationships with people that would draw attention, I absolutely want to honor that. I assume for some candidates, they're not going to worry about walking into the building and coming up to the 11th floor. But
To add more complexity to this, you'll need 3 locations for each day because you're going to have 3 candidates here all on the same day.
yes, Ms. Lester is a very skilled administrative person that performs miracles in an administrative setting. So we are entrusting that to her.
That might mean that you would have to have somebody at least one
Yes.
here. Yeah. So
Yeah, we're going to need to think through the logistics. That we have the time, so everyone has the time commitment on their calendars prepared to do that, and we'll need to give some thought to the logistics. I would include in that, as I think about 5 hours of interviews for a candidate, that's a lot. That is, and it's not that we're not asking candidates a lot, but I think the mental strain. So this is a tweak, but like a 45 minutes interview was probably a sufficient one-on-one interview with breaks in between. Still a large part of a day, but
first test of their stamina.
Yes.
Just a quick recommendation. If it is decided to do it here, my recommendation is to keep it off the 11th floor, because I think between our interim CEO and all the other chief positions, they're all located here. So I'd ask that that be be respectful of the other people that would be seen on this floor.
Yes, it may
One
be.
of-
I'm sorry. Go ahead, Dr. Inser.
One option that will give anonymity is if we did some of the interviews at the Carl Turner Center, have nice conference and office facilities. If we secure those, no one would make any connections.
That's a very reaffirming our partnership with Meharry. That would be lovely if they invited us over. Christy, I'm glad you said that. I think that makes a lot of sense. Not just for the candidates, but for people in the hospital and particularly executive leadership team. All right. Well, we'll explore that option. I think the Cal Turner Center would be a really nice facility to do that.
Would a law office be an option?
A law office would be a fantastic place. My law firm, I will speak for them here publicly, would love to host these interviews if that's the right setting. But or other office. There is adequate office space that we can find if we need an offsite place.
Will there be an opportunity at this setting for our board chair to meet these candidates?
I was going to say, while I'm not a voting committee member, I would welcome the opportunity at this point to be able to be part of that discussion. It is held on my calendar, but would lean to this committee to ascertain whether you would want my input at this point.
That would add a 6th hour.
Mine doesn't need to be as long, and I would want the bulk of what was being talked about divided up between the committee, because ultimately you're the ones voting on it. Mine would maybe just be a little shorter meet and greet, and maybe, more of a tell me about yourself kind of thing. But I would definitely want you guys to do the lift on the content.
A 6-hour day for candidates trust me, is not taxing. It's not taxing on them.
Okay.
When they come as finalists, when they come as finalists, we're talking a day and a half, 2 days, full 2 days. So from a candidate perspective, meeting with the board chair could be important. So I would recommend that as well. Even if not voting, I still think time for the candidates to talk with you, I think, would be valuable.
Yes, I agree. We should. I'm glad. Thank you for keeping that open on your schedule, and welcome you to do that, and agree that that's an important part of this process at this stage.
And then the last comment, as I'm listening to the logistics, setting up the candidate in one location's probably going to be easy. Getting board committee members to those locations. So if they're in the same building, it's easy because you just walk from floor to floor. If you're having to go from building to building, just make sure you build that into the schedule if that's part of it.
One last comment, and just to state this for part of the process, not now, but once we boil it down to the 3 candidates this committee does. I have been asked by the mayor's office to have a part in those discussions as well, just for a meet and greet. So I let them know that we would be happy to facilitate just an introduction. So just wanted to let that be known as part of the process. Again, not voting, but just really to kind of get a feel for the last 3 candidates. So.
Yes, we will absolutely do that. I'm glad that you advised us of that, and that's why at the finalist stage of if there are 3 finalists, 2 or 3 finalists, those are intended to be. They're not. They will be a day and a half or 2 days worth of discussions and meeting with important partners for the hospital. And that would certainly include the mayor's office and many others.
I don't, maybe those dates have already been set up, but if not, we probably ought to set it up so that we can get on the mayor's calendar.
Yes, and once we had this meeting, I am, and nailed down the dates that we are going to be doing these final, well, the second round of interviews after the search groups. I mentioned that we would pick 2 dates for them, so that way, in case for whatever reason there was a delay in this committee's decision, or there was a need to kind of connect on anything, then we could always make sure that we had 2 dates pinned down. So we're on that. We just want to make sure that we get through this process first, and I'll be reconnected with mayor's office after this committee meeting.
You are kind of one step ahead of me, but as we get through and finish first rounds, then I ask the committee members and board to really shift hats, right, to more of recruiting candidates versus interviewing candidates, right? And so this is kind of that step of, who do we include in those meetings? And from not just the organization's lens of evaluating candidates, but from a candidate's lens, who will they need to meet with? Who are the stakeholders that they need to meet with to make informed decisions? And with that being a critically important relationship, highly encouraged to be involved in that process.
Excellent. We will do that and look forward to that process. That will be a very energizing time to recruit candidates and think about the future of the hospital.
Do these candidates know a salary range at all? They do, okay.
They do. With the public information and the information we've provided, they do.
I think somewhere I have seen 3 dates that have already been suggested in May, one of which I will be unavailable. So we need to go through that process of seeing who's available for those 3 dates.
Do you mean for the next
The second interview.
for the
final
finalists?
interview, yes.
The final interviews, those days are on the calendar, and we've not. But I guess we do need to check people's schedules.
I've given Janet the date.
The executive overview that we provided under action items, it has the first round interview dates of April 24th, May 1st, and 8th. We can use all 3. We can use just 2 with 6 candidates. We should be able to use 2, again, depending on candidate availability. Candidates are all aware of those dates as well. And so I don't expect conflicts, but you never know, right? And then the second round interview dates have been identified as potentials for, it looks like Fridays of May 29th, June 5th, and June 12th.
The May 29th is,
Those are all Fridays. Second
I'm
round
not available
interviews.
on the 29th.
Okay.
The May 29th, June 5th, and June 12th. Those would be the second finalist on-site dates. Those would be the day and a half, 2 days of interviews. So we'll probably have to do a Thursday, Friday. When we look at that, travel in on a Thursday, the bulk of the interviews on that Friday. May 29th, June 5th, and June 12th. With the time from now until then, we've got some flexibility that we can build into that if we need to, so.
Do you,
So here's where the shift comes, just to alleviate concerns from the committee members. The most important work and the bulk of the work you're going to do is first round. That's where the weight is on your shoulders to make decisions. Shifting to second round, I go back to recruiting the candidates at that point, right? You will have spent enough time understanding, learning the candidates, that when they come back for second round, it's an opportunity for them to interact with the entire organization, for others to provide you input. At the end of that day, we'd like that candidate to meet with you or the board, the entire board. Then you have a well-informed candidate that can get into a discussion right at the end of the day. So that's where your time commitment would come on that second round.
So we think we can get 3 candidates here on short notice for the 24th.
Yes, they're all aware of those dates, yes.
So our schedule will be, the candidates are aware of the dates. We anticipate that we'll be able to do these interviews on the Fridays that we have set aside for that. And likely we'll only need 2 of those Fridays, not all 3. And we are on track to, at our May 13th meeting, we will have conducted those interviews, and our May 13th meeting will be our meeting to narrow the candidate pool down to the finalists.
Are we still meeting in 2 weeks?
I don't think that it's necessary because we will be having the interviews with this group. So we will be busy doing that, and so that's a good point. Our next meeting will take off the calendar, and we will meet again on May 13th.
Maybe more importantly, me and the team would make ourselves available should anybody have any questions or need any information from us between now and then.
All right, before we formalize our business through a motion, is there any other discussion or questions that people had for Hisham, Julie, Mick regarding the process or where we are right now? I appreciate everyone's patience. It's been a long meeting. It's been a very productive meeting. I really appreciate the AMN team and all the work that they've done. It really is fantastic job that you all realize and know that it was a lot of work, and this was a very difficult decision. You presented 9 candidates, all of whom were very well positioned, qualified. I think by description I could have been enthusiastic about any of them, and that's a testament to your work, and appreciate you giving us a really hard decision to make today. So thank you. Is there a motion that we take 6 candidates, A, B, C, D, E, and G, to move forward in the process for first round interviews?
So moved.
Second.
There's a motion and a second. Is there any discussion on the motion? If not, all those in favor say aye. Aye. Any opposed? Motion carries unanimously. Is there a motion to adjourn? Smooth. There's a motion, and there is an emphatic second. Any discussion? All those in favor of adjournment say aye. Aye. Motion carries. We're adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.